Hello, everybody. Welcome once again to scanO Cafe. And today, I am more than happy, glad, and delighted to introduce our guest for today, Dr. Kartik Bhanushali. He's not just a prosthodontist, a veteran, but also a pioneer of getting digital dentistry to the country and inspiring a lot of young doctors to adopt the latest technology. Welcome to our show, Dr. Kartik.
Thank you. Yeah.
Doctor, let's start with an introduction of what made you uh, be into the field of prosthodontics, and how did you start your journey with digital dentistry back in 1998, right? And then in 2000 when you started the revolution. I'm sure it was not easy.
Mm.
Tell me about your journey and also the challenges associated with it.
See, becoming a prosthodontist was always first choice in terms of the love for art and making something. You know, dentistry is a very intuitive in terms of creating lost body part, and tooth is what we are focusing on. So it was always the first choice during throughout the career. That's the mother branch of dentistry, which we learned a lot during our educational tenure. And most important aspect is how your mentors are. Our mentors were excellent mentors. So how your mentors are, you tend to evolve in that direction. We had excellent mentors in prosthodontics. Dr. Naveen Kothari, Dr. Sabita Ram, and all those are they were the best teachers which taught us how to recreate lost oral structures and what are the benefits. And dentures were the first thing we were focusing in those days. So that was our first choice, and I've been always doing excellent in that throughout my educational period, and topped university in that. And in between I worked as orthodontics assistant
Okay.
also before I joined, because there was a time gap between prosthetics and PG and undergraduation. So I worked with an orthodontist also, and uh, eventually I decided, no, I'm going to do prosthetics only, and
Hmm.
implantology treatment was the more interesting for me for reconstruction. And we had mentors like Dr. Deshpande and all. So all these people influence you that
Hmm.
okay, this is for you, and you had a choice to choose between A or B. And then ultimately I chose to I got an admission in government dental college, and I chose to do the prosthodontics. So that's the reason why I'm in prosthodontics. It's the love for making something. You like to make things,
Hmm.
so you like to make teeth, and that's how we entered into this.
Correct. So then, how did the whole essence of digital dentistry come in play?
Oh,
Because it was not common in India.
yeah,
You are one of the few and pioneers
yeah,
who
yeah.
brought it into India in 2000.
I,
Tell me that story, doctor.
I'll tell you. We started with implantology, and we did lot of implants cases. We we had Dr. NK Doctor as our mentor, who took us to Germany to learn implants. And incidentally, we realized that implants are basically an engineered product, a very fine, super engineered product. And what we are giving on top of it is not matching the crowns and bridges which we made by conventional methods. We are not matching this engineered product, nowhere close to it.
Hmm.
And digital was the answer, because implants are digitally made. So we wanted to refine our restorations. We could do surgical well, we had good results with surgical, but our prosthetics was a challenge with the type of laboratory infrastructures we had, the manual working, there were errors. So we had a quest to find out, what are the methods we can improve so that we can get a equally good restorative manufactured in India. So for that, during my visit to IDS 2004, we were looking around for solutions. IDS is a place. It's a like a time travel. If you want to travel 30 years or 50 years ahead in dentistry, you go to IDS, where you will see how they are doing things in advanced situations. So we got bumped into this company called as 3Shape, and they were demonstrating their then newly developed mechanical scanner for converting a model into a 3D
3D.
printed or into a 3D scan. Before that, Rex Serona was also introduced to us, and it was a mind blowing system. It is still, but it was difficult for us to comprehend how, like, scanner to product in such a, it was like a full package with lot of hidden things happening behind. So we were not knowing exactly what is happening. It was like a magic for us. You had limitations of only sticking to the same system. So there are a lot of other things we wanted to make out of digitization, that not only crowns and bridges, but we wanted to make dentures, we wanted to make removable partial dentures, we wanted to make ortho appliances, we wanted everything in digitization. So 3Shape was a company where they opened up the scenario into only scanning and designing. They started with laboratory first. So their approach was to build a backup first, and then dentist can do digitization. So I got introduced to them, and then slowly we got associated with them, and that's how our journey started with our first lab scanner, which we bought from 3Shape, and that was D640, which probably they never marketed anywhere in India after that. They came out with 700, the version
Right.
700, and since then I'm keenly following their steps. It has been like baby step to do one thing
Right.
at a time, and now after 20 years we see where the digitization has reached and what benefits we all derive from it.
Correct. Absolutely. I think in today's age, it is impossible to imagine or reimagine our practices without digitization.
Digitization.
And the kind of accuracy and speed that we have achieved as a community,
Yeah,
thanks to pioneering companies like 3Shape,
yeah,
and thanks for sharing the journey,
yeah,
is what and why are we today.
yeah.
And I can't await to see how what future holds for us with integration of AI also
Yeah,
in the field of dentistry. And this IDS 2004, this was in Germany, right?
yeah. It's always
Correct.
biannual conference.
Right.
It's always there in Germany, and it's your door to world of dentistry. Like I would call it, like it's a Kashi or Kaaba for what happens. You go there and you are mesmerized. What all dentistry? It opens up your mind towards what dentistry can do to. Uh, when
Correct.
you are in institutions in local situations, you might not realize that what all things can be done in dentistry.
Coming from such a strong industrial background
Hmm.
to your journey as a director of D.Y. Patil College of Dental Sciences, uh, I personally have seen a gap of how academicians would think versus how industrialists would think. And you having a strong background of industry through your experiences, and then as a director of D.Y. Patil, what do you think were your steps that you inculcated in the college and the curriculum, and how responsive was the management and staff and students? Uh, so, if you can
Yeah.
walk us through that.
Yeah, actually, we worked with digitization, and then few years we worked as an industrial company, and then we realized that we need to make changes at the grassroots level. And the grassroots of digital of dentistry is dental schools. So we had this concept that once we educate dentists digitally, then they are equipped to work digitally in the clinics. Instead, of course, not forgetting the conventional or the regular dental workflow, but adding a digital aspect to it while learning. So what you learn, you practice.
Hmm.
And that was the idea in taking up that director situation in a school to start a digital dental college, which will have everything in digital, right from patient database record till the final delivery. And we had idea that okay, even after the doctors pass out from the college, they can remain connected with the institutes because of the digital thing.
Correct.
Because digital is everywhere. So that was our concept. And how we inculcated is we started a digital laboratory in the department of prosthodontics there. And all the students will at least get exposed to how the digitization work. During their curriculum, we had a lot of seminars training them hands on with scanners. And slowly the management and everybody also started realizing that yes, digitization, because it was a school,
Hmm.
a dental school, but the campus was integrated with engineering.
Hmm.
So they had two engineering schools, they had design institute, car design. So they were all well versed about technology, that how technology can influence the design and manufacturing.
Hmm.
So they very well understood about digitization process. And now it's a postgraduate institute. Yeah.
Correct. So all the processes that we have right from educating patient before he comes into the school or hospital, being connected or engaged with the school has been digitized both
Yeah.
at the undergraduation and the post-graduation level.
Post-graduation, yes.
Are you happy with the things that are currently implemented after you left, or you think there could have been more additions with respect to AI, since the
Yeah.
speed of integrating AI and technology in dentistry is still at a different level in the Western world as we see
Yeah.
compared to here? So, what are those pain points or maybe a few lacunae which are still there that we need to fill as a dental community to pace up to the Western world?
There are a lot of things like you said, right from the patient engagement, how you are presenting him. See, our country is to an extent we can call it as illiterate about dental health. We are literate now about overall thing, but about dental health we are still an illiterate country.
Hmm.
So a lot of people don't know what is their problem. So what digitization helps is making them active partner in the treatment process, in understanding their problems first, and then taking a proactive actions to maintain the health. Because dentistry is a ongoing process. It's not like that you've been once and then everything is okay for all life. It's ongoing process. So institutions, if they have database, if they have digital records, if they keep all the data at one place, and recall recall their patients,
Hmm.
recall their doctors, and maintain the data to understand what impact it has, what the treatment has impact on the population.
Hmm.
Today we don't know. Maybe treat and the patient goes home. We don't know how he is, whether he is comfortable, whether he is having problems, whether. So if he is not coming back to you, there are only two things: either he has gone to other doctor,
Hmm.
or he is no more alive. So
Correct.
data collection is very important, and digitization is is an not an alternative, is the thing for acquiring the data. Even if at the student level, we tried getting digitization for training dental students. So while students are learning dentistry, they cannot uh, anticipate all the situations probably they would have in their practices
Clearly.
on the models which they work. Those are standard models since 1900. So they are normal anatomies. So what digitization does is, with the help of haptic technologies and digitization incorporated into it, they can actually practice on real time patients. So the patients whom they are going to treat before they go into their clinics, they can practice on a digital platform and then go and print, or then go and treat patient in clinics.
Correct.
It's like a pilot doing his 300 hours of flight training in a simulator. So there are digital platforms, dental simulators, where they can practice whatever they are doing in the going to do in the patient's mouth on different clinical situations, like in strom or like this. So everything is practiced and they're more confident when they enter into the clinical part.
Clinics. Correct.
And they are more trained to handle all the situations instead of getting panicked or looking for support when they are in a problem, because ideal things don't exist in this world.
Correct.
So I am yet to do a ideal class 1 in any patient's mouth.
Right.
So uh, digitization is real time,
Right.
and lot of technologies go in. I was at ECTA University in Netherlands, where they have actually implemented this in training dental students. So even if you're doing a class 1 cavity, the class 1 cavity, what the doctor does is completely digitized. How he does, which instruments he is using, how accurate he is. So that is digitization, helping during learning, practicing that accuracy, and then the same accuracy is transferred onto the clinical situation.
Right.
So that inclination to do better, because prosthodontic digitization is only on the work what the dentist does in the patient's mouth. So he has to be equally good for doing digital output. So he
Correct.
has to accustom to the digitization, because lot of principles like GV Black principles of cavities and all those things have now changed because of the way we are practicing today. So with digitization, the accuracy has to go up.
Imagine the outcomes, right? As you
Exactly.
mentioned, the outcomes would be so personalized.
Yes.
And as you rightly said, till date you've never done a class 1 ideal cavity,
Ideal
right?
cavity.
I think oral cavity is the most dynamic one, and we
Absolutely
can
right.
never have the ideal conditions, let alone those, but the same situation being repeated because of the the functions of an oral cavity.
Yes.
And I think, as you rightly said, digitization can only help us do better,
Yeah.
do more personalized work, and slowly with this I think we can get at a pace of what the western world is doing with respect to
Definitely.
integrating AI.
Definitely.
Right. I mean, doctor, if we have to put a number of, and I know the number will be very small, of the percentage of, say, schools, dental schools in India or practitioners who've been really maintaining their data, not just immediately post treatment, but a follow up of 6 months, 1 year, 2 years, and follow on, how much would that percentage be?
Every postgraduate institute where they have post graduation may have this data with their students who are pursuing their post graduation for 2 to 3 years. Post that, even he may not have his the data. So that's the limitation. When they are doing their postgraduate studies, they will maintain some data of follow up to their educational level. But then see, data is so enormous and it is generating so fast that it's a research in itself.
Yes.
When you have so many cases going on, like in a 200 chair dental college, there are practically hundreds of patients being treated in different departments, so much of data generated every day. So analysis of that data is in itself a research.
Yes.
So for that they have to first capture the
The
data,
data, right?
digitize it,
Yes.
because it requires lot of post processing.
Correct.
And with 3D scanners and other digital infrastructure coming in,
Hmm.
this is becoming a reality.
Right.
Now they are getting adapted. Some people are converting their hard data into digital data. So slowly, I have seen a lot of evolution in institutions. Also, they are having interdepartmental computerizations
Hmm.
and all those things. So it is just going to improve and become better.
Just getting started, I think,
Yes.
right?
Yeah.
With this, I genuinely feel that as dentists, I don't know, or as Indians, maybe we are thinking very short term, right? It could be either
Exactly.
maintaining data just for 3 years for
Yeah.
my post graduation,
Yeah.
or maybe for 5 years during my undergraduation when I really need that patient.
Yeah.
Once I'm done, I don't want to think long term.
Long term.
That's what we need to change as dental surgeons.
Yeah.
And do you think the implementation of the digitization of health from government bodies like what we have today, ABH, ABA,
Mm.
has been understood by all the practitioners slash being integrated, or there is a gap again,
There's a
right? In
huge gap.
yeah, because
Yeah.
government has initiated it, but then it's our role to integrate all the data
Yeah.
and to attach all the data that we are producing and analyzing to a unique number of say Aadhaar or the security number of that
Yeah.
patient.
Yeah.
And
It's a long way process,
hmm,
and I think there are many other aspects other than just analyzing. Like I presented my kind of paper on forensic odontology. Now that's the after fingerprints, after eyeball,
hmm,
teeth are the most unique for every individual. So having data of huge population with their present teeth in place is an enormous task. That itself is so important. Like you can link it to ID number, and into any situation where you need to have a identification. Like tooth is such a strong structure that even in a bomb blast, if you find a tooth,
hmm,
you can derive the chromosomes of it and find out whose body it is. Plane crashes, train accidents, wherever. So for identity, it is an amazing structure, and world over, they are using it in forensic odontology, and in India also, in Gujarat, I think they have started specialization in forensic odontology. So a lot of work is being done
hmm.
for keeping the data, analyzing the data, and teeth are a very unique feature for every individual.
Hardly, I mean, less than 0.5% of layman,
Yeah.
our patients, our users, or consumers would know the uniqueness of teeth, as Dr. Karthik mentioned, right? After fingerprint and after eyeball, teeth are the most unique.
Yeah.
And you can backtrace not just about the individual, but what race he belongs to, or what archaeology, or
Yeah.
what dated it belongs to. So it's that unique, and that
Stem cells. You
stem
can
cells
get
too,
stem cells from the pulp of the
and
tooth.
grow an organ, right? An
Yep.
entire organ out of it. That brings me to the personalization, how unique the teeth are, how unique the gums are, how unique the tongue is. We also require personalized treatments
Yeah.
for all of those patients. It's not one size fits all.
Yeah.
And I think AI has a very big role in
Of
driving
course.
that personalization. Now that, let's create a hypothesis situation that the digitization is up to the par and everything is digitized. How do you then think the AI will add on to the magic or the element of that personalized care for every patient, understanding the root causes, and just change the way we deliver oral health?
Yes.
Yeah.
See, AI in radiology, dental radiology, like we take CBCT scans, we take OPGs, we take IOPAs. So AI has huge impact in that. AI in intraoral scanning, AI in diagnostic scanning, all these data, when you are eventually looking at, uh, AI is always bigger than a singular doctor experience. Like if I've done 30 years of my practice, and whatever data I have in my brain or analysis, AI is much bigger than that. So it can give you a lot of other options, that this could have been done much better. This could have been done much better in this case. So whenever you reach out to AI, AI will give you a lot of options, and then it can be chosen whether this is good or this is good for an individual, depending upon how he wants to feel or look like. So AI has enormous adaptability and applications. uh, I will tell you my experience again in IDS. There is this designer from Disney. So Disney is a cartoon company, but they are making an AI app for smile designing.
For smile
For
designing.
smile designing, and it's a magic. Like Disney, whatever Disney does is magic, right?
Correct.
So this Capono, I remember his name, and he has designed a software in which you just stand in front of an iPad, and with ting design, it will change the smile of your patient. And then he'll give lot of proposals, like proposal A, whiter teeth; proposal B, longer teeth; proposal C, slightly shorter teeth, or gums seen more. So all these proposals are possible, and whatever the patient eventually feels that he wants to look like that, that has to be matched with the reality.
Wow.
So
This is Disney
yeah,
making AI for smile designing
yes,
for cartoons or for actual adults?
for actual
Adults,
humans,
right?
yeah, for
This
actual
is
humans.
crazy.
I'll share a video of that
Yeah.
to you.
Yes.
Yeah.
I mean, look, and so this shows that sky's the limit,
Yes.
and maybe as dental surgeons we think very limited,
Yes.
and when we see global companies
Yeah.
investing so
Yeah.
much of time and
Huge.
research onto this, it kind of blows our mind, right? Opens up our minds.
Yeah. It really blows up. Dental has been totally neglected and most abused part of human body, and especially in India, where we eat 4 times a day or 3 times a day, and we hardly know there is a tooth in the mouth because it's so natural till the time it doesn't pain.
Yes.
So pain is the only thing which brings people to our offices. Looks is there, of course. There is a percentage of population who is more focused on aesthetics and looks, so they actually start from orthodontic treatment, so they derive in that situation, and that percentage is growing. I can tell you, there's a lot of backlog. So I get a lot of young people who always wanted to look better,
Hmm.
but due to some reasons they could not get their treatments done, so they now want to start with Invisalign therapy and want invisible braces, so that they'll have their smiles fixed up for the health reason and not only for looks alone.
Wow.
So there is a change in dynamics, how people have started thinking about the teeth.
Correct. No, it's a very relevant point,
Yeah.
and we see multiple startups,
Yeah.
both in international and national market, have also influenced the way people think about
Yes.
uh, teeth straightening treatments, right?
Yeah.
And they are also getting it made for relevant reasons of health and not just aesthetics. But as a young dentist in the same community, I sometimes wonder, when will we see a day when people will actually start taking preventive treatment seriously, getting fillings in time to prevent an RCT, getting maybe an RCT in time to prevent extraction and implant. Uh, what do you think? Is that day very far off? Because still there has not been a trend in this particular segment. We've seen a lot of trend in the cosmetic and the corrective segment. What are your thoughts in preventive segment?
See, prevention is better than cure, always. And I can tell you, just by getting your teeth straightened in one place prevents 90% of your dental revisits. And that's the reason why there is so much of importance to orthodontics. Teeth are naturally designed to work harmoniously in the mouth if they are just placed well. It's like a garden. If the trees are placed well, they are natural. The problem is when they become jungle, and then all the problems start. So prevention is at early inception, right from the childhood, when the milk teeth are falling, or even preventing the milk teeth decay, and then how they are evolving, how they are maintained. So it's a continuous process till the time third molar appears in life at the age of 18 to 25. So Western countries have realized that dental treatments is a journey, and there's a data which says that people visit dentist more than a general health practitioner in first world countries, because there are various stages in life you have to visit the dentist. It's started happening in India. We are in private practices. We see a lot of young patients. Parents who are educated are more careful about their children's teeth. Then young adults are also very focused on their health, and of course senior citizens. Uh, they want to get the best in the fag of their life. At least they can eat well.
Correct.
If
Right.
nothing else can be done. So it is it, it is the most important part of life, and I think government of India has taken a lot of initiatives, but still needs to take more initiatives. Like we discussed, the diagnostic systems can be installed at various public places, and giving free checkups to the population mass, collecting their data and coming to a logical reasons why they have to have certain hospitals or certain type of treatments or certain type of doctors in certain areas, instead of just haywire everything is just spreading like that. So this is a huge thing in digitization, to have patients get regularly checked up. So like there was weighing machines, if you remember.
Yes.
So to check your weights, the government wanted that you should do your weight every time you go out on the railway station or
Correct.
bus stations or hospitals. So like that, they should also have oral screenings. These screens can be placed everywhere in the public places, maybe in the hospitals, in railway stations, in bus depots, everywhere, and people get free analysis of their problems which they are not aware of. And most important, to reduce this menace of oral gutkas, tobaccos, smoking.
Correct.
Unless or until they are aware about their oral health, they will not stop this. So this will play a big role in
Right.
making awareness.
Absolutely. I think we did see a good reduction in obesity
Yeah.
after the weighing machines were placed everywhere.
Yes.
And I think similarly, the way Indians have started traveling so much, especially after COVID, not just at the bus stops and the railway, but at the airports and malls,
Yeah.
where we see so much of footfalls.
Yeah.
It's like giving the power of oral screening in their hands,
Yeah.
like democratizing oral checkups for everybody.
Yeah.
And then automatically, as the community, as dentists, we'll see the magic of people being proactive
Yes.
and coming for treatments. And I think that answers my question, that one day when this happens, we will see a day when people will come in automatically for preventive treatments.
Yes. So,
and not just for corrective and cosmetic.
true. DIY scanning or screening of their own mouth using their own cell phones also is going a big way, but we need to collect the data.
Correct.
Just having the data is not enough. So there is huge potential for this technology.
Right. I think that has been a wonderful chat
Yeah,
from 1998
yeah,
to 2000 to your journey in 2004,
24.
and how are we looking at what's already happening in the dental industry with respect to, of course, the digitization, but also AI. Last two questions, doctor. First is, how do you see the future of dentistry? Not something which is already happening in the Eastern or the Western world, but some crazy thoughts or imaginations that you might have had in your head and you want to say it aloud first. And second question, which is the last, would be any parting message for our community, who, especially, we have the median age of 28.6. We have a lot of young doctors who are around,
Yeah,
and we, the youth doctors, can play a big role in making the crazy thought in your head
yeah,
come true.
yeah.
So these two things, doctor. Yeah.
Yeah, the craziest thought I have in my hand is to be able to reconstruct like a prosthodontist, to able to recreate, reconstruct uh, everything in house with the help of technology, and prevention also, like robotics, inclusive of robotics in dentistry, getting it more and more precise. And the most craziest one is dentist not sitting in the clinic, but he's sitting in the console.
In the
In the console,
console.
like the radiologist sits away from the radiology equipment. So dentist is sitting in the console. He has programmed everything for his patients, like from his preparations or cavity preparations till the restoration. And the patient is relaxed, he's sleeping in the room, he is remotely just observing whether things are going right or wrong. He doesn't even have to actively work on that patient at that moment. So collecting data, like collecting CBCT data, collecting intraoral scans, collecting facial scans, all these integrated and pre-planned treatments, purely chalked out. And machines are there, or the robots are pre-programmed for that. So everything is done the way it has to be done, without any manual intervention. During the time of COVID, I myself faced a lot of issues. Probably I was also infected or affected with it, and a lot of ill health issues were there. So dentist is a profession where you are having health hazards of getting exposed with organic viruses
Yes.
all the time when you are working close to the patient. And that is the most important part, the in future, which can be avoided. So and the stress is reduced on both sides, for the dentist and for the patient also. So the patient is also aware, he's been told, like when you go to the flight, you are told that okay, it may crash, but we have a additional suit for you in emergency. And so everything is sorted out, and when they are going to a clinic, they are peaceful. Some people will still feel anxiety, but then the journey is not stressful and painful. Whenever they see dentist, they feel, oh, I'll have a problem. But instead, the whole scenario is turned upside down. Going to a dentist should be a very pleasing experience. Okay, we went there, we sat, relaxed. Everything was told to me. Okay, this is what a problem is. This is how it is going to be, and it is predictable, easy, and fast.
Correct. Wow.
So
Yeah.
that's the craziest idea I have. It should be like people should love to go to a dentist.
Love to go to dentist.
They want to go to a dentist.
Right. And I absolutely love the way you've said how we can have or tend to have automated workflows,
Yeah,
where
systems in place.
everything in place. Correct.
Today we don't have systems in place. We have bits from here, bits from there, and we're trying to adapt things.
Do a
So
jugaad.
that's what we did today, right? We had a simplified digitization does not have to be complex.
Correct. Thank you for sharing your craziest idea. And what kind of future do you see in field of dentistry to make that dream come true? What is your parting message to the dentists who are youth, who have so much of time to invest their thought processes, to have a right direction, and to make that dream come true?
See, according to me, every dentist has to be a digital dentist. He cannot afford to not digitize his work, including diagnosis, including treatment planning, inter-departmental discussions for making your plan better, and taking control of your own treatment plan. In today's scenario, what I observe is dental clinics, they are making it like only a data collection, or maybe just doing what the dentist is doing and then sending the work back to the lab. And then there is a huge difference between what you have committed to the patient and what you get from the laboratory, because you don't send enough of data, and the people who process the data are not actually dentists.
Hmm.
Many a times they are not even science oriented people, they are artists or maybe just trained technicians. So if dentists have time with them, they can invest their valuable time in creating, in working out with the designing processes of their patients, their restorations, and then just take help of technology by 3D printing or machining it. So the whole treatment is under the control of the dentist, and he doesn't have to part the share of his earnings to someone. So making in-house,
Hmm.
like there are a lot of situations where you have to make in-house for personalization. Today, even a sandwich is personalized. Like they make their own breads,
Correct.
they make their own stuffings as per as the patient wants. So if you are not in control of the making process, and you cannot deliver what people want, that's where the gap is,
Hmm.
because you are getting it done from somebody, and they will do as they feel is right. They don't do bad job, but
Correct.
what is possible with what data you are sending them? If they use your facial scanner, they can correlate well with the prosthesis, but they are, you just send them models or you just send them small data, they cannot correlate the whole patient. On top of it, when dentist is working himself, he is working with a human, right? There are so many aspects of a human which they have to take into consideration. That one particular treatment may not be okay for the patient who is sitting in your chair than the other one. So your treatment is so personalized. If you have input at every stage or control of it, then you can deliver better to the patient.
Correct. Thank you, doctor. It was a wonderful and one of the most unique things that I've heard. This parting message of first being a digital dentist, there's no option otherwise, and learning the DIY thing, doing it yourself, giving the power to your patients, empowering them, and of course, having everything in house so that you can give the best personalized treatment with patient centric care. We are so humbled and glad for this episode, doctor. There are really tons of learnings that I am also taking back home.
Mhm.
And I really hope all of you enjoyed, all of you learned. And if you have any questions with respect to digital dentistry, with respect to scanners, or just with respect to anything, feel free to drop a comment or message us, and we would be more than happy to reply to you and help you solve your query. Thank you again, Doctor.
Thank you very much.
It was a pleasure to have you, and I really appreciate you taking out so much of
Thank
your time on a busy day
you. No, it's
during the expo.